Morning, everyone, and welcome to our webinar. I'm Megan Hunter, the President and CEO of the Morris County Chamber of Commerce and Economic Development Corporation. We're pleased to have you join us this morning for an update from the Morris County OEM and Sheriff's Office. You're about to hear the extraordinary things that the Morris County officials have been doing to safeguard your health and that of the county. So I would like to thank all of you for actively participating in our seminars, and I encourage you to visit our website at morrischamber.org to see all of the upcoming events that we have scheduled. At the Chamber, we still continue to fulfill our mission. We connect, we convene, we facilitate, we educate, and we advocate, and now we're doing it virtually. So thank you for joining us today, and I'd like to turn it over to Freeholder Deputy Director Stephen Shaw.
Thank you, Megan. Good morning. I really want to thank the Chamber for hosting this webinar. They've been an incredible partner throughout the crisis. The webinars you've been hosting and the study you did with Senator Bucca have been key to keeping our residents and the business community informed. In addition to the panelists, I believe some of my Freeholder colleagues are also on the line. I believe Freeholder Master Angelo and Freeholder Krikis. And I apologize, I can't see the attendees if I left somebody off. But first, I just want to say on behalf of the entire Freeholder Board, our thoughts and prayers go out to all the families impacted by this insidious virus. And I also want to thank our healthcare workers, first responders, and so many volunteers that have been on the front lines helping us combat the virus. You know, going back to late February, that's when the county was already planning for the COVID-19 pandemic. I don't think anybody thought or anticipated the depth, the breadth, the duration, and the impact that this virus would have on our country, the state, and our county here in Morris. Initially, you know, the freeholders were really focused on managing the public health crisis with a reduced staff and working around the clock and working remotely. We had to adapt to the delivery of essential county services, procure PPE, set up triage tents at the hospitals and a testing center, and coordinating with our local municipal partners and health departments. I think a lot of people don't realize on a regular basis the county supports many of our most vulnerable residents, including supporting over 2,000 veterans. None of this would be possible, though, if it was not for the incredible dedication and work of so many, including our panelists today. That's Scott DiGirolamo, he's our Director of the Morris County Department of Law and Public Safety, Jeff Paul, the Director of Emergency Management, and our own Sheriff Gannon. This was all quarterbacked by the County Administrator, John Bonani, and the Assistant County Administrator, Dean O'Leary. We're grateful for all that you have done. Now that the worst is behind us, the freeholders are pivoting to planning for the future with our Morris Recovery Task Force and our Internal Strategic Advisory Committee. I'm a small business owner, and this is my office as well. Sorry about that. Unfortunately, you know, in addition to pivoting and planning for the future, one unfortunate part of all of this is we have not received any state or federal CARES Act funding to help offset the costs that we've incurred affecting the public health. So we're working on a bipartisan basis now to bring an equitable share to Morris County. Once again, I just want to say thank you for all you're doing at the Chamber, and thanking our panelists.
You're on mute, Megan.
Thank you, Deputy Director. Mike, you want to turn it over to our next panelist?
Yeah, absolutely. So we're going to go over now to Scott DiGirolamo. And Scott, the floor is yours. And then we'll go over to Jeff Paul and Sheriff Gannon. And then we're going to open it up to Q&A. So if you have any questions, please type them in the Q&A feature. And if you hover your mouse over the bottom of your screen, you'll see a chat and a Q&A. The questions are Q&A, and the chat is for you to introduce yourself and talk to other folks on the chat. So go ahead, Scott.
Very much, Mike. Well, good morning, everyone. It's nice to be here. It's even better to be here in a little different situation than we were, and I honestly lost track of time, but on our last conference call with the Chamber when we were really in the middle of the crisis at the height of it, and our focus certainly from the county level and from law and public safety and emergency management was on supporting the hospitals and worrying about fatality management and worried about the amount of sick people and Now we're transitioning a little bit. Some of that has calmed down, and we're really focusing still on keeping those numbers down and also pivoting towards the recovery and what do we do to support the recovery. I just want to take a second before I talk about some of our things, because I think sometimes it's understated. Is one of the things that have really helped this county respond well is the support that we've gotten from the board, and I know a lot of my colleagues in the other counties didn't get that, and as Deputy Director Shaw was talking, it kind of set with me a little bit. When we were in the middle of the crisis and being a department director on day-to-day management, most of what we're focused on, you always have cost and resources in mind of what you're trying to get done if you're coming to ask for more resources. And early on in this event, the board's, discussion to me and kind of orders to me is do what we need to do, order what we need to do to protect the public. There were, people dying on a daily basis, and we put a lot of resources, including actually going out and with county dollars purchasing protective equipment to get out to the local responders and some of the healthcare workers. And a couple of weeks ago, as we started, while we were still in that crisis phase, we were starting to look at ahead for what the county can do to support the recovery and the transition and reopening. And the directives that I got back from the board at that point is do what we need to do and put in place so that we can do our part to facilitate that movement to getting businesses back open and going. And with that, and I'll talk a little bit about some of the things that we put in place, things that you've heard about contact tracing, and we were allowed to hire a couple extra resources in health management to oversee some of the public health activities that we're going to need to do in the coming months. So that has really been a key focus for us moving forward, of having that support. So I want to talk about a couple of the different areas that we're working. As you know, we set up, now we're probably 3 months into it, a community testing site so people can come to be tested. The good news is when we started this we started at the end of March, but in April, our height was we were actually testing about 375 appointments a day of people coming through the county college site to be tested. Many of those people were very sick. It was obvious from the people that were working the site. You could see how sick the people were. Several had to be transported from here. Several had gotten tested and wound up in the intensive care unit on ventilators within a day or two of being here. A big piece of this is a medical reserve corps, which are volunteers. From many of them have medical backgrounds that have helped and have been the reception area for this, being the first contact that people coming to be tested interacted with, and nurses that were supplied by Atlantic that actually conducted the test. This week, we were down to about, our lowest day was 42 people had appointments to come through here. Our percentages when we first started, about 43% of the people that came through the site tested positive. Last week, we were down into the mid-single digits of people testing positive. As part of this transition of what we can do, part of our focus as we have less people that are actually symptomatic and sick is being able to do testing for healthcare workers that don't have symptoms, asymptomatic people, first responders we're transitioning to. There's some studies that just came out this week that are validating some of the concerns that a larger number that are expected of people that have the virus, that could be spreading the virus, actually have no symptoms. So for those critical workers that are in contact with the public, one of the things that the state has been pushing out is to start having those people tested, even if they're not showing symptoms. So we've been doing some of that this week, and we're going to scale up to be able to do more of that next week and publicize that a little bit further. So that's a lot on the testing. We've got a lot of support on that, and we're running 5 days a week from 9 until 12 based on the volume that we're doing. Our thought there is getting people tested. An important component for this, and really one of our overall objectives, is to put in place what we have in Morris County so we can limit the spread as things start to open up. The belief is that people that are contagious have the more ability to spread it. The way that we limit it is identify those people that have the virus, that are infected, so have somebody get in contact with them to make sure they isolate, and make sure people that were exposed to those people know to be watching for symptoms and potentially be tested themselves. So that really transitions me into another portion of what we're doing from the public health perspective, and this is really being done at the local health level, whether it's a local health department in a town or the county that has contracts with a number of towns to do local health, and then at the county level to have a capability to support those local health departments as we move forward if they need extra staff to do some of that tracing. So there's a term you've heard quite a bit on the news and the area is contact tracing. I think it's important for the chamber members to understand the reality for what that is. It's a basic health tool, public health tool that's been used for decades, and it's simply a matter of when there's information of a communicable disease, if somebody has a communicable disease, that somebody from public health is able to speak to that person, tell them the protective actions that they should take, whether it's going to see a doctor or certain communicable diseases, treatments that are available, or what they should do, and specifically with COVID, of isolating, staying away from your family, not spreading it, and what the time frames are. And then to ask that person who else they've had close contact with so that those people could be contacted to let them know to watch for symptoms. There's very strict protocols, so on that contact tracing, the contacts that get traced are never told who it was that was confirmed. And I'll move this to something that those of you with children probably have heard every year. It comes out someplace when a meningitis issue happens at a college campus or in a high school, whether it be bacterial or viral meningitis. The important part for that is when the laboratory or the doctor reports to public health, which is required by law to do, that a person has the communicable disease, and let's use meningitis, the public health department will speak to that person, find out who was close to that person, maybe dorm mates or spent a lot of time with that person, and they'll call those other people to give them, here's the symptoms that you want to do, or talk to your healthcare provider to talk about maybe a prophylactic treatment or what needs to be done. That's really the extent of contact tracing. There's other countries that have other techniques for contact tracing. That is how public health works in the United States and in New Jersey. It's really phone call based. To protect people's privacy, there is a statewide communicable disease reporting system that's used for all communicable diseases. The state is actually standing up I'll say a separate software program that's limited to COVID, so that the people that are doing contact tracing only have access to the COVID information and not all the other information, so that they can reach out and then track. And that system, from what we're hearing, is going to be interoperable with New York City systems and Connecticut systems, so that if somebody works in New York City but lives in New Jersey and that person tests positive, there's visibility on both sides of who needs to be contacted and who needs to be followed. To that end, what we've done is we're using a lot, and I said it before because some of those great volunteers are helping us at the site here. We're also using for contact tracing the Medical Reserve Corps, which are volunteers. On the contact tracing end, they will be medical volunteers. Most of them are nurses or medical professionals that also volunteer, and they'll be set up to make those phone calls if we need to do the contact tracing. And we're doing that in a scaled approach. We've identified about 70 people who have agreed to do it that we've done training for, and we will bring those on as we need them. If we don't need them, we won't use them. The local health departments will do it, but our thought process is if we do see an uptick and there's an outbreak in a particular town or a particular area or in a particular business, we'll be able to bring enough people in to get in contact with everybody that needs to be contacted within 24 hours. That's really the goal that the state asked, is that within notification of a positive case, that person is contacted within 24 hours, and any of their contacts are contacted within 24 hours of finding out who those contacts are. So we are set for that. Part of it, when we don't know a lot of the details from the state yet, is to make sure Morris County is well positioned to handle it within Morris County. So if it moves to places being opened or things being loosened based on how counties are prepared, we want to make sure that we're fully prepared to be able to do that and get businesses back open and people back to their lives. So that's really what we're doing at our level. A couple of key pieces of information for you is on the County Office of Health Management website. There's constantly updated information, but one of the most valuable sources that everybody should be referring to frequently is the Center for Disease Control websites. There's information that they're posting, including coming out now. There's 2 documents that they've posted that's appropriate for business that I'm aware of. One is how to get your water systems in your buildings back up safely if everything's been turned off for a period of time. and they released one, I think, yesterday or today, is just about some of the protective things that businesses should be doing as they open up to make it safe for their employees. So that's really, in a nutshell, for here. I left our division for the emergency management. Jeff really has been handling that, so I'll pass it over to Jeff Paul, who's our Director of Emergency Management, to talk about some of the specific OEM functions we've been doing. Jeff?
Thanks, Scott. And let me just also say thank you to the Chamber for hosting this call. I'm speaking from the Morris County Emergency Operations Center, obviously. I just want to echo one of the comments that Scott made, and that's the support that we have all seen, from the freeholders and from County Administration, John Manani and Dean O'Leary. And I think it's important to emphasize that, because in the world that we operate in, we don't have a whole lot of time to make decisions that really impact the public, certainly like it did in this particular case. We have to, act swiftly, appropriately, and we need people that are capable of making those decisions. And we had that happen literally time after time for this particular event. So thanks. The public should know that, and we're thankful. Really what we've been concentrating on here, and we've been doing this, quite frankly, in partnership with the sheriff, is really the outreach to all our municipalities, specifically the hospitals, long-term health, all senior facilities, emergency responders, police, fire, EMS, everything that has an impact on servicing the public from a medical perspective, whether it's home health care, all of that has been coordinated out of here. And we have been really focusing our efforts on the PPE and the equipment that's needed to come in contact with these patients, whether it's on a first responder capacity, on an ambulance, on a police car, fire truck, or the hospital. So we set up all the testing center systems at the hospital, Morristown Medical, Chilton, St. Clair's, Sioux Fall. All the 10 systems are part of what we have here at the county level for events such as this. So it was a huge undertaking. It didn't just involve emergency management. As I said, the sheriff partnered with us throughout the whole thing. We also had the Morris County Park Police and many, many other entities that supported this, our fire division and every division, and certainly we're working very closely with health. So what's happening right now is we on a daily basis are interacting with all of the long-term healthcare and health, determining COVID status in every facility in the county, making sure they have the appropriate equipment. We're delivering, we just delivered all the test kits. In fact, the sheriff's team is out as we speak, delivering right now to a number of facilities. We'll be doing that again next week. We have had shortages on some equipment. The county's been great about allowing us to resupply where we can actually even find supplies. But we do have a large stockpile of items that are expected to be coming in soon. So our focus really is making sure that equipment is where it needs to be. We have a county EMS program as well that was very overwhelmed in the early stages of this event, where we're responding to COVID calls. We work very closely, obviously, with our 911 center, the communication center. They've been overwhelmed as well throughout this event. But all in all, being quite frank, it was challenging at times, but the county family and all the responders and everybody that makes up the county response really came together in a big way to support this. And we've been here from day one. There hasn't been days off yet. We're hoping for some of that soon, but we're here to serve the public, and we really appreciate the support that we've been getting, not only from the sheriff's office, but from everywhere. And I don't want to keep on talking. I'd rather leave time for questions for anything specific. Thank you.
Okay, thanks,
If
Jeff.
Scott, again, and I'll transition over to the sheriff, but I just wanted to say one thing. You heard me say a lot, we, as we're talking, and when I say we, I really don't mean Department of Law and Public Safety. I mean, as Jeff says, it's a county family. One of those really is, and I was thinking before, Jeff in his previous life and the sheriff in his previous life, I think we started working together in the 80s. And that is one of the great things about this county, is it really all just pulls together, and we really don't look at different divisions. And I'll use the example, I think a lot of you have dealt with Jeff over time in emergency management. A lot of people come to emergency management. There's 4 people that are in emergency management. Most of what we do when it requires the horsepower to actually get out there and deliver stuff is what we're doing now. And the sheriff is always been a great partner with that. We're using his staff up at CCM. We're using his staff in emergency management every day. The park police, the public works people, all those people really get together. So it really is just one team that goes on for that. So Sheriff, I'll turn it over to you from some of the stuff that you've been doing helping us.
Thank you, Scott. Good morning, and thank you very much for hosting this, the Morris County Chamber of Commerce. Megan, thanks for your leadership during this tough time. You know, this is all about public-private partnership. It's no secret, right? We make things happen. You know, we talk about, I know the freeholders are on board with this, Director Shaw's here, and freeholder Crickets and Mastrangelo, I believe, are on board, that we talk about Morris County does it better. And it's simply the truth, you know. And I think if there's one takeaway for the public, it's that. You know, we talk about, you know, Scott DiGirolamo and Jeff Paul. Jeff Paul and I go back when I had a full head of hair in 1983. We're in the police academy together. So we go back to that level. Scott in the 80s. Mike Stanzilis, I worked with in the corporate world. He's a, you know, we all know him as a corporate security specialist. So that level of folks that we know each other, that's a great starting point. I know Director Shaw for a long time. But I echo, to start this off, you can have the greatest ideas in the world, but if you can't implement them because there's a hurdle, a financial hurdle, or there's some type of hurdle, you're not going to get it done. But rest assured, Morris County, that you're in a good place because of that relationship that's there. You know, obviously tough times, you know, for all of us. For business, it's no secret. And we talk about the fact we're trying to turn on. I personally think we're getting to the point it's ready to turn on in a calibrated way. Obviously, we'll follow the science and remain calm and do it right. But I want to talk to you about what we've been doing in the Sheriff's Office, you know, to try to complement what's going on with the Office of Emergency Management, Department of Law and Public Safety. And obviously, this is a public health event. So we're focused on that. You know, we provide services there. I also run the Morris County Correctional Facility, and we saw COVID-19 run through the facility like it would run through a cruise ship. Okay, it's simply a cruise ship without the water, the correctional facility. And we had inmates sick, we had officers sick. I went public with it early on. We had 30 officers sick, right? That's a lot. And so some tough times with regards to that. I'm very happy to report that everybody's in good health now. I have a couple positive inmates, but everybody's in good health. So we're in good shape there. And even in my Bureau of Law Enforcement, in the traditional sheriff's office, I had people sick. You know, we had EMS workers who passed that operated in this county. You know, it's a real issue. But as you heard, you know, Jeff and Scott speak about, we supported the direction of the Office of Emergency Management with regards to the PPE delivery. It was a big issue. You know, waiting for the national stockpile wasn't really getting us anywhere. But decisions were made to purchase and to procure and to distribute and try to keep people alive. And I think really tremendous work was done given the dynamics of what was at play, to tell you the truth. And the Park Police were great partners with regards to that. You know, at County College of Morris, we have resources up there today. I'm up there every day. I was up there this morning actually early, and I think the numbers are probably around 6,000 people that have come through the tent up there to get tested. You heard Scott DiGirolamo speak about 43%. We started, now we're in the mid-single digits and maybe even trending further downward. So good things happening with regards from a public health perspective. And many of the people we're seeing now, although we're sick in the early days, we were 43%, we're very sick. Now we're seeing people need to return to work. People need maybe to go to, you know, go back to work, or they need some surgery or something like that. And that's why they're getting tested. So you see some things. But the Sheriff's Office has also continued the routine services of the Sheriff's Office, you know, running the correctional facility. But we also provide specialized police services to your municipal police departments throughout Morris County. So our K-9 unit's been out there answering calls out there right now. Our bomb squad's been out there. CSI, crime scene investigation, out there right now. Our CERT team, our Sheriff's Emergency Response Team, being out there to support the local police department. You know, from a crime perspective, for the first 2 weeks, it was pretty quiet. People were locked down. But as people started to come out of their homes, we experienced a lot of auto theft and things like that. We experienced fraud, COVID fraud, those types of things. But our CERT team has been out there to support the local municipalities many times. Hope One, Hope One is the mobile access recovery vehicle that goes out into the community, and we've been out and had contact with about 11,447 people as of this morning out in the community. But one of the things we saw in COVID-19 is our fatal overdoses are up 50%. Okay, why are they up 50%? I would suggest to you that there's a little less interdiction. There's a perception that there's a lack of services. There's hopelessness and those types of things. There are various byproducts of, I think, COVID-19. You know, there's tolerance change when people aren't using drugs, those types of things. So you always have to keep that in scope. You know, right now, as I sit here, we're at 36 fatalities this year. That's 50% up year to date, right? Our victim is about 35 years old, almost equal men and women. Women are coming up, you know. I have a phone call to make since I've been on this call, of a person who needs to go into detox this morning. People are reaching out. We have those services. We've been Narcan training people via Zoom. So we've been using technology to provide the services, but we haven't been out there in the homeless communities and things like that. But we're going to start back on Monday, out in the homeless communities twice a week with regards to that. We've been dealing a lot with issues of nutrition and food throughout the county. The freeholders have supported that, getting food out to people. Let me tell you something. As you all know, we've been around a long time doing this. I've gone to see 300 people in line, and you know, they looked like me and they drove cars like me. You know, there's a lot of people struggling right now, people that wouldn't want to take the handout that are out there right now that are getting online for food. So I just want to sort of bring it around with regards to that. It's a big issue. It's a big issue, but we have a good thing going on. Anything that's been brought to the table, we've, through the support of the freeholders and all the people on the call, we've been able to execute. There's nothing where, oh my, I can't believe we didn't do this. If someone has an idea and it's a good idea, it gets implemented. So I really applaud the leadership of this and everybody who's making it all happen. And again, to the chamber, thanks for pulling it all together. I love these calls. I think they're great. If there's something that we can do, let us know. We're all ears. We're all ears. You know, everybody looks through a different lens. So let us know what we can do to make it better. That's what we're looking to do. Thank you.
Great. So thank you all.
Thank you, Sheriff.
Megan, we got a few questions here. Do you have anything you want to say, or should we go right to the questions?
No, I just want to thank the panelists and please, Michael,
All right. So
go answer the questions.
We have a couple of questions from Maria Russo Farris. Where can I get tested, and do I need a prescription to get tested? And what kind of tests do we do if we are healthy?
Okay, I'll take that one. So there's a number of different places to get tested. At the county site right now, we do require a prescription because of the way that the site is set up. That may change in the future, but right now it does require a prescription. There's no charge for the test as you come through here. There are a number of Rite Aids, Walgreens are starting it soon, and a number of urgent cares that are doing the test as well. The test that we do here is a PCR test. It's the swab in your nose. We changed from the swab that went all the way to the back of your throat to a swab that only goes an inch up into each nostril. And that test is really just designed to tell you if you have an active infection at the time. You probably heard a lot about the antibody testing that's done by typically a blood draw. We are not doing that here. The state's perspective right now on that is because there's no data yet as to whether if you have antibodies, it necessarily means that you have any immunity. They're not recommending it right now from a public health perspective, and we're not doing that. So we're only doing that PCR test to tell you if you have an active infection or not.
Great. So thank you. The other question we have here is similar to testing, Scott, and it says, where can I get antibody testing done right now? And do I need a doctor's prescription to get those done?
That would be, again, some doctors are doing them, some urgent cares are doing them. The caution would be there was a number of antibody tests when they first came out that were not FDA approved, so there are a few that are FDA approved. Most of those are blood draws. And again, and some are popping up. Some laboratories are actually doing mobile testing, so I would just do an internet search if you're interested in that, or speak to your healthcare provider.
Great. And I want to remind everybody that you can type your questions into the Q&A at the bottom. Another question here is, me and my family had something in the last week of January through mid-February. Do we need a prescription again? So it's the same question. So there's a lot of questions going on out here about testing. This is another one for Sheriff Gannon. And Sheriff, there's people that are concerned about the staffing levels at the jails, and how are your corrections officers doing, and how's the staffing levels there?
Hey, thank you. It was interesting. I looked at the staffing every day in comparison to who was sick, and found out that there really people heroically came to work. I didn't have any problem with staffing. I know the minimums we need because of classification, security, medical, fire rescue, all those things. There's minimums you need. We keep close to the vest. There's minimums you need in the facility. But people heroically came to work. You know, if they just had, you know, a minor ache or pain that wasn't attributed to COVID, they came to work, or maybe sometimes they would have taken a day off or something. So I had zero problems with that. It was a concern. It was something we looked at around the clock, but no problems with that at all. And I can't say enough about them. You know, when you have a facility where you have a decent percentage of the population, almost 10% was sick at any one time, you know, you could have the best protocols in the world and things like that. I could tell you that I said an extra prayer at night, you know, with regards to that. We looked at it really closely, but I applaud them for coming to work every day and just fighting through it and masking up and saying, this is our job and we're going to do it. So I had no problems, but I think we all look at that from a leadership perspective, you know, but great question.
Yeah, and thanks to your leadership, you know, we didn't end up like our neighboring cities across the river with the large population of corrections officers sick.
Right.
Next question is, what populations could still benefit from support, i.e. inmate, military, veterans, special needs, homeless, people in transition, and so forth?
That question for me, I'm sorry.
It's for the panel. It's the panel at large, and they're just talking about what populations could still benefit. So you already talked about inmate. What about military or veterans or special needs people that are out there, homeless and people in transition?
Mike, I can take a stab at that. I think something that you know, always goes on behind the scenes and a lot of residents aren't aware of, and that's all the services, the health and human services the county does provide. On a regular year, we provide 360,000 meals to over 2,000 clients. The Morris Area Paratransit, that's the MAPS program, we do 50,000 trips a year on average, and we assist over 2,000 veterans with 3,300 calls, 577 office visits, home visits, and 7,500 SNAP cases. So the big challenge was, and it was met by our administration, was to deliver all those services remotely. So that's still being done. And the same thing with the homeless population. We even have provisions with actually federal dollars to be able to isolate the homeless population that is COVID positive and put them up in shelter while they quarantine. So that's all happening. I would say that there's always a need for blood donations through the Red Cross. That's one way. And food, that was mentioned already. There's a lot of food banks out there. There's 4 major ones in the county. And a lot of times that's orchestrated through places of worship. So I would say that, you know, keeping tabs on how your local food bank is doing and supporting them is key. And once again, if you have an elderly neighbor or somebody you know, be neighborly, check in on them. You know, they might have to be quarantining and can't get to the grocery store. You can help them out with that. Somebody used the term county family. It truly is a family, and you know, we just need to support our family through this crisis.
Thank you so much. Another question here is, kind of a crystal ball question, and it goes out to the panel at large, and I think Megan could probably also chime in on this question as well. But again, it's a crystal ball, but it's a good question, and it's on everybody's mind. The executive order is due to expire in the first week of June for the shelter at home. Do you anticipate it being extended again for an additional 30 days? Put it out there to you.
I'll jump on mine. I'm looking at my crystal ball now. So I think there's two orders. People are using them interchangeably. There's the executive order, which is the declaration of emergency that was issued by the governor, and then there's the implementation of the Health Powers Act. The Health Powers Act is the one that's set to expire. My guess is that the Health Powers Act will get extended because it's under that they are able to issue a lot of the waivers that they did for different healthcare providers in different areas. I would think that the declaration of emergency will continue, but I do believe some of the orders that are issued under those will continue to change and loosen up. That would be my guess.
Yeah, if I could just dovetail on that, it's my belief that the economy needs to turn on, and people have to get back to work, and you can do that with precautions. And I'm not saying that you won't have a little bit of a spike or something like that. That can happen, okay? But I think we need to do that. We've gone from a public health event to now we have to look at turning on the economy, right? And we're all very conscious of that. I think that I find myself, and I'm out in the community at nauseum, right? I'm out there all the time. I find myself that people are wearing masks. I do see them being very respectful of social distance and those types of things. I think they recognize the fact that this is very important that they do this. But like outdoor seating at restaurants and those types of things, I think we need to do that. I think you need to open up America, open up Morris County, and do it in a calibrated way, and have some benchmarks set as to, have some dates, have some benchmarks set, and implement it, in operational periods, in essence, right? But that's my hope that Trenton, and it's not an R and a D thing. My hope that they recognize this and move forward, and hopefully they will.
Yeah.
And I think just a point of clarification. I think from the opening business up and getting people out, those are not contingent on whether or not that the Health Powers Act expires or is extended. Those are two distinct functions. I agree with the sheriff. And I think you're going to start seeing more things open, but you'll probably see some of those, some of the orders and the Health Powers Act go on a little longer.
Great. Yeah, it's a great question. It's on everybody's mind. Okay, next question here is, what is the status of the court operations?
The courts, it's interesting, since the pandemic, the courts have gone to virtual mode. As of yesterday, I think they hit 80,000 cases have been disposed of statewide, different actions. So a lot is going on. The court's been pretty busy in a virtual capacity. I sit on the subcommittee. I'm the president of the New Jersey Sheriff's Association, and I'm sitting on a panel that we're meeting at 1 o'clock today, a subcommittee to deal with how we're going to open the courts. No one has a date yet. That'll be set forth by Stu Rabner, Chief Justice, and Judge Grant. But I would say sometime in the summer, going to open maybe at 25% capacity or whatever the case may be. But we're looking at a number of things without looking at architectural changes. So we're looking at a number of things involving how to get people in and out, trying to manage the court calendar a little tighter, those types of things, so we don't have people just stacking up. We have jury assembly. We have 110 people come in for juries and things like that. How are we going to socially distance them? So there's a lot of changes. I just finished a draft document. It's pretty comprehensive to look at all the different issues, ADA issues and things like that. But I think if you need court action, it's happening, but mainly in the virtual sense. But there are plans, and there's been a lot of time. I think there's 16 people on these subcommittees that are dealing with this, And we're dealing with guidance from the Department of Health and guidance from the CDC on how to ride in elevators together and things like that. So a lot of things going on. We don't have a firm date. I would suggest it's going to be, though, in the summer.
Great. Thank you. Another question in for the sheriff. Are you still doing the Sheriff's Labor Assistance Program, also known as SLAP?
We put it on pause right now, but we'll be getting back out there in the very short term, probably in a week or two. So if everybody knows, the Sheriff's Labor Assistance Program takes care of a lot of, 501c3s that don't have money, say cemeteries that are full, that have no more money coming in. We cut the grass and those types of things, do a lot of painting and Knights of Columbus's and things like that, museums and things like that. It's a great program. It's free labor, and it just helps the municipalities and it helps other people within the community. So we will be kickstarting that again.
That's good to hear. This question is for Jeff Paul, and it is referencing the EMTs. They clearly are on the front lines and they're exposed on a regular basis on the calls that they're probably getting. How are they doing, and how is the health of the EMTs?
Let me give Jeff a chance. I know we had a call coming up with the state. Jeff, are you still on? All right, I can take that. Similar to what the sheriff said with the corrections officers, I think we've really seen some amazing people and some amazing professions come up, both on the volunteer EMTs in the towns that continue to take call. I know from our EMS agency that went out assisting a lot of towns, they were taking multiple confirmed COVID cases in our ambulances every day. They've done well. They've showed up every day. We made sure they had the right protection. I will say this because my mother always said, don't spit in the wind, but I'm knocking on wood as we say it. We have not had any of them sick. We made sure that they were protected well, and they've done an incredible job throughout this. I think EMS in general was put in a position during this that they really never were before. From the different emergency services, from the EMS people, the first thing you're taught as an EMT when you go into school is the first consideration that you make is the scene safe? And if it's not, you let the fire department put the fire out, or the police department secure a person to make it safe. And in this case, most of those other disciplines were standing outside the building, and the EMTs were going in to get the patient and bring them out and put them in a small ambulance and bring it down. So they have done a fantastic job. My hats are off to all of them, and they continue to be out there serving the public every day.
Yeah, that's great. They certainly have done a great job. It was a lot was mentioned earlier about the testing site at CCM, and Megan, we do have an esteemed guest on the call. I think you promoted him to panelist, if I'm not mistaken.
I did. We have Dr. Iacono with us today. Tony, are you there?
Yes, I am. How are you today?
Good morning. Would you like to share with us some updates from CCM?
Sure, I can share a little bit. Let me just start though with a huge thank you. I put a little note on here. I'll tell you what, we use the tagline that Morris County is a great place to live, work, and play. And even in the darkest times, we really shine. And I can tell you, and I want a big thank you from the Board of Trustees and our college community, our employees and students alike, to our freeholders, to Sheriff Gannon and his team, to the Office of Emergency Management, the Chamber, and everyone who's involved across. The support we're getting is absolutely extraordinary. It is not, it's way above normal than what my peers are experiencing around the state, and I thank you all for that. I told Sheriff Gannon his operation with OEM is what he and Scott and Jeff have designed is so wildly efficient. I'm going to have them handle registration for us. They really know how to serve people in a highly efficient manner. We're doing great at the college, and our enrollment is actually up for the summer, and we'll begin focusing on fall enrollment soon. A big part of what we're preparing to do is, as things begin to come back online, is to reboot our workforce program. And we usually serve about 5,000 or more people a year with job training or upskilling programs and so forth. So we're looking forward to being able to serve Morris County in that way. But we are also seeing a very large number of university students who have enrolled with us for the summer, and we think it's likely they'll be staying with us for the fall also. So we are that really good, high quality, but very safe choice right now for many individuals. And so we're happy to do our part for Morris County. We're very proud that the testing center is on the campus, and we are open to any suggestions of how we can help beyond what we're already doing. We're happy to do so. I know that Jim and I, and with support from freeholders and others, Megan, you're with us on this. We'll be doing a food drive on the campus later in June with Reverend Sidney Williams and his mobile food unit. So yet another great example of how this county comes together. But I simply can't say thank you enough, and really starting with our freeholders and County Administrator John Bonanni and others. But Megan, these calls are super helpful, and I think they help us all stay plugged in and keep us working well together. So thank you.
Great. Thank you, Tony.
And
Back to you, Mike.
I just want to take a moment to thank Tony as well, because when the, where do we set up a site, and it's one phone call to CCM and we have a location. And not only is it using the site in the parking lot, but it's using a lot of the staff and the other facilities at CCM. So it's just, once again, it's a phenomenal partnership. And while I'm talking, I know there was a question about, I mentioned the food pantries, and Tony just mentioned one, but there's a listing on the county website, morriscountynewjersey.gov. Some of the big ones are Interfaith Food Pantry, Nourish New Jersey, Table of Hope. And there's a listing, though, of every local food pantry with contact information there as well.
Mike, could I mention something from OEM perspective?
Please.
And I dropped off for a bit, so I apologize if this was already stated. But one of the things I just wanted to point out, that when we got hit hard in the beginning, there was a public outcry for PPE. And we saw donations that were being dropped off by the public and doctors' offices and medical practices, some of whom need that PPE now, came to our aid and the aid of our residents and the long-term care facilities, and really gave us a tremendous amount of product that we were able to turn back around with the sheriff's office and get it back out to the people. But one of the things that actually happened at the county college, and I know, we mentioned how gracious they were to host the facility, but, when I placed that phone call to Steve Ackerman, who's a retired captain from the sheriff's office, and he got a hold of the good doctor he just heard from, there was no wiffle-waffling. It was basically a yes for everything. And one of the things that the county college did was they started to manufacture some product as well in the way of, face shields and things. And I've gotten countless calls from them with regards to products that we needed. And one thing they did do is they really took all the equipment from their nursing and medical programs at the college at a time when we were searching for ventilators for patients that needed those ventilators. And they quickly rallied all of the equipment for the nursing programs. And we got that delivered courtesy of County College of Morris to the hospital. So there was a lot happening through so many different avenues, but County College certainly, both, on the educational side as well as security, did a phenomenal job. We're very thankful for that.
Thank you.
Our School of Technology also, helped with that effort as well.
They delivered here as well. Yes, they did. Yes, they did.
So on that line of thought, you must have read our minds here, because Jeff, the question is, experts are predicting that this could come back again in the fall or late summer in the flu season. Are we prepared for the next go around with our PPEs like we were not prepared in the past? Are we stockpiling and getting ready for the next go around?
Yeah, and I can tell you this is a conversation that Scott and I are having every single day. We are working on formulas and calculations as we speak, and we are preparing for that to occur with the hopes that it doesn't. So in our business, I don't want to alarm anybody. When we say we're planning for it to occur, that's what we do. So we're planning for a reoccurrence because we need to prepare for that. We need to have inventory to do that. So that's what we're working on right now. The good news for the public, though, is we have a phenomenal freeholder board and county administration that's right behind us. So I'm sure that all they demand of us is giving them accurate data with some good backups as to how we came to those conclusions. And I'm very comfortable to say that we will be prepared.
That's great to hear. So speaking of the future here, another question is, will there be an after-action meeting with an after-action sort of report and what our findings are, what we've learned from this, and lessons learned for the future?
I can start off with that. I can start off with that. Hey, Scott, remember this conversation yesterday? We've already been doing that. We've already been doing that on the after action, talking about it, and going through it. And like Scott says, I think the good thing, we know each other a long time, and we're brutally honest with each other. And that's what you need to be. And that's all of us. How are we servicing you from a chamber perspective, from a business perspective? How are we doing it from a public health perspective? How are we doing it from an emergency management? How are we taking care of each other with regards to, the EMS side, the police side, the fire side, all of that? What are we looking at in almost having our own Morris County stockpile, those types of things? Yeah, I think we've been doing that already, but I think we will sit down formally and go through all those types of things. And there will be lessons learned with regards to this. I already have a group that's planning for the fall. While we're ongoing, they're planning for the fall already, and taking some of the lessons learned early on. I mean, one of the big things we did at the jail was we intercepted a lot of our people who are positive COVID at the door through temperature screening. A simple thing like that, but that's where we intercepted a lot of people. But I want to just leave before I pass it off to Jeff and Scott, is that one thing that's interesting about Dr. Iacono, I have a hard time calling him Tony. He's a great guy, a good friend. But when Tony was asked about that place, like Director Shaw said, about County College of Morris, he said, yeah, no problem. What do we need to do? It wasn't like, let me sort this out. He understood the issue and says, yeah, what do we need to do? And again, seamless, Tony. I applaud you. I applaud your staff and all of that. And let us know how we can help you. I started right. County College. Okay.
Thank you, Sheriff.
Thanks.
One of our favorite alum. Thank you very much. It really is a pleasure and an honor to support, though. Thank you.
Thanks.
The next question is, will there be a billboard with Sheriff Gannon on it? I started right.
Hopefully not.
This question goes out to Scott. You kind of addressed it in your opening comments, but it talks about the local municipal public health officers. They appear to be overwhelmed at first. And, what kind of assistance will be provided to them? I know the freeholders have an incredible plan in place.
Well, I mean, and so I think everybody, the public health system was a bit overwhelmed, not just local health at the beginning, just because of the number of people that were testing positive and the workloads and the sizes of everybody. New Jersey is set, and statutorily, health is at the local health level. Many are well positioned now, and they're getting the contact tracing out as they get positive cases and handling that. We're doing it for the contract towns that we have. Our feeling was we had the resources to do it, to make sure that we could supplement them if the need was there. That's also what the state is trying to do. When you see on the news that they're talking about hiring 1,000 to 5,000 people at the state level, I think our belief is if we can handle it at the county level, it's more responsive, it's more local. If we needed to move to the state, we can do that. I think it's about everybody working together.
That's great. So don't hesitate to type in your questions out there. Right now, there's no more questions left in the queue.
I have to correct the sheriff. He's twice referred to me as a director. He promoted me. I appreciate that, but I do want to, on behalf of Director Smith, she had a conflict and couldn't be with us this morning. I'm here as the deputy director. So thanks for the promotion, Sheriff.
So noted.
Great. So I don't see any more questions out there, but I do see that we have at least one chief of police out there in the queue and as a panelist. And I know that, Sheriff Gannon and Jeff and Scott work closely with all our local police departments. Is there anything you'd like to say from a county level to our 39 local municipalities within our police departments?
Well, I'll certainly start. I think we're all going to say the same thing, but the chiefs of police, Chief Oliver and Chester, who's the president of the organization, we're exchanging emails daily. The chief is sending out emails to everyone, and they're a great partner with us. Obviously, we're communicating with the chiefs and county prosecutor's office and again, the county law enforcement agencies. But I mean, we couldn't do this without the chiefs. They're part of what we call our emergency support function here at the EOC. This was a different kind of event because we were all working via social distancing and trying to minimize contact. But the chiefs are the backbone in the local municipalities behind everything that we're ultimately doing. So they're right shoulder to shoulder with us.
I echo what Jeff says. Phenomenal job. Great leadership by Chief Williver. You know, really took the bull by the horns, given daily updates, on call with Trenton on a daily basis, and great work. I tell you that. You know, the police departments are the constant in these municipalities. You know, a lot of times they run emergency management locally and those types of things, but we have a great relationship with them. And on that same thread, that local EMS that Scott spoke about, that local fire department that Scott many times volunteer in our communities, and they're really the backbone of that local services and that local municipality. And, you know, they're placed in harm's way. A lot of people placed in harm's way, police, fire, and EMS. You know, on a county level, we get to plan sometimes before we take action. A lot of times they're responding to unknown calls in environments that are unsafe. And things like that. I really applaud the police, fire, and EMS throughout the whole county. Again, second to none. Great work. Thank you.
Yeah, I know we have Chief LeBruno on the call, and I know he's worked very closely with Jeff Paul to help him get PPEs for his. They're not just getting it for their fire departments; they're getting it for the DPW and other departments that are out there on the front lines as well. So thank you, Chief LeBruno and Jeff. One more question here is, how can we help now, and how can we support the prep for the next wave, and how can we support this during these pandemics? And this is open to the panel at large.
You know, I'll jump on the general thing. I think it's keeping, as we get opened up, is keeping informed of how best to protect your families and your employees. Follow those guidelines that come out. I think where I start get concerned is the further we move away from that crisis phase, the more we start getting mixed messages from different media outlets and different agendas. And, you know, the CDC is the premier agency when it comes to public health and the epidemics. And I think we saw even they had to learn and some things changed, but they have the best information, and follow that. Set yourself up with the social distancing. And, you know, I think another way that we can help each other are these periodic calls that we can all get together. We can give you the information that we have and the plans that we have moving forward, and that may be a good avenue to figure out how you best can support on your end back to us.
Well, that's great. That's great. So I think it would, we're getting closer to the end of this call, and it may warrant us to go back to the panelists, and then Megan will close out for closing comments here. But it's been very, very educational. Thank you all so much. So I hand it back to Scott, then Jeff, then the Sheriff Gannon, Freeholder Deputy Director Shaw, and then Megan Hunter, President of the Morris County Chamber. So Scott, floor is yours for closing comments.
Sure, thank you. No, I'll just close with thanking everybody. Thank you for the chamber for organizing these, and even during the crisis for checking with us to how you can support it. The businesses that were there, certainly CCM, that maybe will give you your parking lot back someday. So you know, I appreciate it, and I just wish the best for your families and your employees coming back, and hope everybody stays healthy.
Great, thanks. Jeff?
Thanks, Mike. I think the only thing I'd like to point out, and it's really a shout out to the public, is, you know, obviously pay attention to the data, but, you know, we're at a point now where we need to open, we need to get back, you know, people need to get to work, they need to, you know, business needs to thrive, but at the same time, this disease is not going anywhere. So we need to be very mindful of that. We can't get complacent, we can't get sloppy, we can't throw away the masks. We are by no means over those issues. I said, and we need to keep that on the forefront in order to keep the curve where we want it, and that's flat. So, you know, although we need to get out of our homes, go to work, and do what we need to do it differently than we have in the past. And by no means is it going to be business as usual.
Thank you. Sheriff Gannon?
Yeah, if I could echo that, we all know we have to move to open business and the economy. We all know that. we can do that and we can be successful at this, okay, if we follow the science. I agree. It's not going away. That social distancing and PPE, masks and those types of things, and sanitizing areas, your workspace, and those types of things may be here for some time, and in essence, maybe forever. I'm a fan of Dr. Fauci. Dr. Fauci's been around since 1984. He's in the early days of AIDS and things like that. He's a brilliant guy. Cornell, first place in his class, right? Cornell. Just a brilliant man. And regardless of what you think about it, keep politics out of it. This is about public health. This is about the economy. This affects a lot of people that don't vote. It has nothing to do with that. And I think that's the bad thing. When there's a crisis, people look for, on a national level even, and things look for getting things done. And then sometimes politics get in the way. This is not about politics. This is about public health that affects us all, especially our elderly population, people we hold in high regard, in our communities and everybody. So I think do that. Just be careful with it. And lastly, let's do this again. Once we start opening up, let's do it again, virtually, and talk it through a little bit with regards to the best practices, the documents that Scott shared with you, those types of things, when you're turning back on your water systems and things like that. There's other things that go along. Our deputy director happens to know a little about that from business, from building and things like that, right, and engineering. So we have to look at those types of things. And we're a resource for you, okay? We like to work. We're a resource for you, okay, that can help you turn on your business. And if you have a question on how we're moving pedestrian traffic and those types of things in your buildings, we're all about that. We want you to do it safely and you to be successful. Thank you.
Thank you, Sheriff. And I think we have Deputy Director Steve Shaw, closing comments.
Thank you. I always try to look for a silver lining, and I'm fortunate to live in a beautiful community on a little lake, and that lake is packed with kids fishing, people boating, people paddle boarding. So I do think while it's been tough, there has been opportunities for families to reconnect. I think that's a positive. I think also, you put things in perspective, and the little things that we took for granted, going out to dinner with friends, we realize how valuable that is, and how to cherish that when we get that back, and we will get it back, and it might look a little different. And that's what we're doing on the county level right now. We're looking at how the county is going to look different, and county services are going to be delivered differently. I also think there's an opportunity here because we've got folks that are maybe looking at the suburbs a little differently and the commute into Manhattan a little differently than they did before this. So just like I think CCM is seeing, folks that are going to be looking to choose their county college or we're going away to school, I think some folks might be looking to the suburbs in Morris County a little differently. And I think that's all positive as long as we manage it. And once again, I just want to thank the Chamber for putting this together and being a long-time partner with us. Thank you.
Thank you. Just quickly, I know we promoted Dr. Iacono, so before we go to Megan for final comments, the good doctor, do you have anything you'd like to add?
Only to ask others if we can serve you, let us know. We're still capable of making more face shields and other items, but any way we can serve you, that's why we're here. We are the community's college, so thank you again.
Thank you. And Megan, why don't you close it out for us?
Thank you, Michael. So I want to thank all of you for being with us today. Thank you for your leadership to our panelists. I also want to thank Michael for his spearheading of our task force report that was recently released. So if you haven't seen it, please visit our website, morrischamber.org, under our COVID information page. Morris County is truly an extraordinary place, as Dr. Iacono said, wonderful place to work, live, raise children, and play. And so we know that we will get through this. We'll get through this together. And I look forward to seeing you all on a future webinar. So thank you and have a wonderful weekend.